Hi, my name is Ficucello. I'm a physical therapist at Helen Hospital. I work on the spinal cord injury and amputee unit. So at Helen Hospital, we get patients for multiple reasons, whether it's a spinal cord injury, an amputee, a nerve disease, and whatever the injury is, they usually require some type of strengthening for their upper body and some type of cardio workout, conditioning to work on their endurance. So the therapy ropes, which is a very good tool, it does both functions, that it can give them that cardio endurance type workout while also strengthening the upper body to help out if they're using a wheelchair or if they're going to return to walking, that it can help with both goals. So in this case, the patient in the video is recovering from a bilateral lower extremity amputation. And while he's going through his recovery process of getting his prosthetic legs and returning to walking and being upright, in that recovery process, he's using a wheelchair primarily to get around and for all of his therapy. So while that's going on, I still want to get a cardio workout and a strengthening workout that will help him now while he's using a wheelchair, but also moving forward when he gets upright and working on walking, that he's going to need good endurance, he's going to need good upper body strength to help with that part of his recovery in the future. The rope in this video is quite heavy, so a 1 minute burst continuously is enough that you're pretty fatigued, whether you're in the hospital or a healthy individual who works out a lot. It's actually a very good exercise for just 1 minute. Lighter ropes you could do for a little bit longer. It's very easy to transition the ropes to home as long as you have the space for it. You simply wrap the rope around a sturdy object, a bed, a piece of furniture, and as long as they have the length of space in their house, it's very easy to use in that environment. And you can find the ropes easily in any fitness magazine. When it comes to patients who are in a wheelchair using the ropes, it depends on their injury. Let's say if someone has a spinal cord injury and maybe their sitting balance isn't the greatest. As long as there's a seatbelt on the wheelchair, the patient is safe. You may have to utilize another strap in case they need more assistance at their upper body, but given those two things, it doesn't impede using the ropes, that they can still do the exercise, and then the straps are just helping keep them sitting upright in their chair. And the exercise is exactly the same as anyone else who didn't have a spinal cord injury. When it comes to the feedback that I've gotten from patients on how they like the workout, they like that they're getting results in a short amount of time. I think patients tend to want results quick, and when you can get strengthening and their heart rate and respiratory rate is up in just a minute of exercise, they feel like they've done a lot of work in a short amount of time, which is a good feeling. For someone who's standing and their goal is, I want to go back to walking and being on my feet, so the exercise does not have to be done sitting. You can do it standing. You can make it more challenging by changing what they're standing on, a piece of foam, something unstable, or changing the way they stand, that you're challenging their standing balance, while also giving them a very vigorous upper body workout at the same time. So it works well, both in a wheelchair that someone cannot stand or someone is standing, and now you're working on other things in a standing position and also doing an upper body workout.
Nice job.